Hello everyone and welcome to our channel PhysioSaurus. In today's video I am going to talk about the kinematics of shoulder joint. Okay, so what I am going to discuss in this video, let's talk about that first. So whatever the joints which are present in the shoulder complex, we will talk about that. Okay, so there are four joints which shows the movement. One is glenohumeral joint, the second one is your acromioclavicular joint, and the third one is sternoclavicular joint, and the fourth and the last one is scapulothoracic joint. Okay, so these are the four joints which are present in the shoulder complex, and we will talk about its kinematics one by one. And there are few special motions in the shoulder complex. One is scapulohumeral rhythm and the second one is companion motion. Okay, so after we will finish the kinematics of these four joints, we will study about scapulohumeral rhythm and the companion motion of shoulder complex. Now let's talk about the first one. Okay, so it is glenohumeral joint, or you can say the kinematics of glenohumeral joint. Okay, now what I am going to discuss, so there are 4 points. Okay, in 4 points I am going to discuss the kinematics, and the first one is, so what are the movements which occurs in the glenohumeral joint? The first movement is the flexion. Okay, now we will talk about flexion movement. So basically flexion movement occurs in the frontal axis, okay, frontal axis and in sagittal plane, okay. And when we will talk about its osteokinematics, so first you need to understand how the flexion movement occurs. So in flexion movement, your humerus bone moves forward. Okay, so humerus bone moves forward and its range of motion is 0 degree to 120 degree. Okay, now when we will talk about its orthokinematics, we will discuss the gliding and the rolling direction. So in this case, in the flexion case, convex surface moves on concave surface. Okay, concave surface. So the gliding occurs in the posterior direction, but rolling will be in the anterior direction. Now if you don't know the concave convex rule, I want the viewers to check out my playlist. I have already uploaded a video on concave convex rule, so please go watch that video and then you will be able to understand what is concave convex rule and how the gliding is posterior in the flexion of glenohumeral joint and why the rolling is anterior in glenohumeral joint, in the flexion of glenohumeral joint. So basically, if humerus move forward and convex surface moves on concave surface, then the gliding would be opposite. So if humerus moves forward, then the gliding will be in the backward or in the posterior direction. Now let's talk about the same in extension movement. Okay, first the axis and the plane. So it will be frontal axis and sagittal plane, Now we are going to talk about its osteokinematics. Okay, so in osteokinematics, in the extension movement, the humerus bone moves backward. Okay, the complete opposite of the flexion. Okay, and the range of motion will be 0 degree to 120 degree. Okay, and if you will talk about its orthokinematics, okay, orthokinematics. So what will be the orthokinematics? Here the convex surface moves on concave surface, so the gliding will be opposite. So gliding will be the opposite of backward, that means it will be anterior, but rolling is always in the same direction, so rolling will be posterior. Okay, now let's move on to the abduction and adduction movement. Okay, so abduction and adduction movement. So in abduction, it occurs in the sagittal axis So axis will be sagittal and the plane will be the frontal plane. Now let's move on to its osteokinematics. So in osteokinematics, or in the abduction movement, the humerus bone moves laterally upward, okay, and the range of motion is 0 degree to 120 degree. Now let's talk about its orthokinematics. So here again convex surface is moving on concave surface, okay. So the gliding will be opposite. So if humerus is moving laterally upward, then the gliding will be in the inferior direction, okay, and the rolling will be in the same direction as the humerus is moving. So rolling will be in the superior direction. So this was all about the abduction movement. Now let's talk about the fourth movement, which is adduction movement. Now what happens in adduction? In adduction, it takes place on sagittal axis and frontal plane, okay, sagittal axis and frontal plane. If we will talk about its osteokinematics, then humerus moves medially downward, okay, and the range of motion will be complete opposite of the abduction movement of glenohumeral joint. So range of motion will be 120 degree to 0 degree. Now let's talk about its orthokinematics, okay, So what will be in the orthokinematics? So here again convex surface is moving on concave surface, okay, So the gliding will be in the opposite direction. So the gliding will be in superior. Why superior? Because humerus is moving in the downward direction, medially downward direction. So gliding will be in the opposite direction. That means it will be in the superior. But rolling will always be in the same direction. So rolling will be in the inferior direction. Now let's talk about the other movements of the glenohumeral joint, which is internal rotation and the external rotation. So the internal rotation happens in the vertical axis, okay, and in transverse plane, which is similar to the external rotation, because external rotation also happens in the vertical axis and transverse plane. Now talking about the osteokinematics, you need to hear this correctly, okay. So please focus on what I am saying right now. Lateral rotation causes the medial epicondyle of humerus to move anteriorly. I'll repeat what I am saying right now. The medial epicondyle of humerus moves posteriorly in the internal rotation, okay, but the medial epicondyle of humerus moves anteriorly in external rotation. If you are not sure about that, you can do the movement while flexing the elbow 90 degree, okay. Now let's talk about the range of motion, okay, which is 0 degree to 90 degree, okay, in both of the cases. That means in the internal rotation and in the external rotation, okay. So 0 degree to the 90 degree. Now let's talk about the orthokinematics, okay, Talking about the orthokinematics, here the convex surface is moving on the concave surface, okay, in both of the cases, okay. So in the both cases, convex is moving on concave surface, okay. So the gliding is posterior in the internal rotation, while rolling is anterior in internal rotation. Okay, and the gliding will be anterior in external rotation and rolling will be posterior in external rotation. So this was all about the internal and external rotation. Next we will talk about the horizontal abduction and the horizontal adduction. Okay, so now we will talk about the horizontal abduction and the horizontal adduction of the glenohumeral joint, which are the last two movement of the glenohumeral joint. So first we will talk about the axis and plane. So axis will be vertical axis in both of the cases. Okay, so vertical axis, and the plane would be transverse plane. Okay, so transverse plane. So the movement is happening on the vertical axis and the transverse plane in both of the cases. Now let's move on to the osteokinematics. Okay, osteokinematics. In osteokinematics, the humerus moves posteriorly at 90-degree abduction in case of horizontal abduction. Okay, so what we will write here, we will write humerus moves posteriorly at 90-degree abduction. Okay, humerus moves posteriorly at 90-degree abduction, and in case of horizontal adduction, the humerus moves medially at 90-degree abduction. Okay, now the range of motion for horizontal abduction is 0 degree to the 30 degree, and the range of movement for horizontal adduction is 0 degree to 120 degree. Okay, now let's talk about the orthokinematics. Now in orthokinematics, we will talk about the surfaces, which surface rolls on which surface. So basically here convex surface moves over the concave surface. Okay, so convex surface moves on concave surface. Okay, and the gliding in horizontal abduction will be anterior, while rolling will be completely opposite, that will be posterior. Okay, and in the case of horizontal adduction, the gliding will be posterior and rolling will be vice versa. Okay, so that means it will be anterior. So this was all about the kinematics of glenohumeral joint. Sorry, one thing I have forgot to mention. What I forgot is, basically in the internal rotation in the osteokinematics, you can say that humerus, it moves medially. Okay, humerus moves medially, and in the case of external rotation, the humerus, it moves laterally. Okay, humerus moves laterally at glenohumeral joint. So this was all about the kinematics of glenohumeral joint. I am very sure you will like this video. So thank you so much for watching this video. The next video will be all about the other three joints in the shoulder complex.